So let's chat about earlobes. So one of the biggest complaints I think that we see with ears is that like people, I guess, wear their earrings and then it rips through and they have kind of an opening there or a complete tear and they come in wanting it fixed. So what are your thoughts on, I guess, most common things that cause it to rip open? And also like, you know, we've talked about this sort of off the air about like different challenges of fixing like different types of earlobe tears and the complexities that could be involved. But, you know, I guess how do you kind of like picture it in your mind about like the different types of it, what causes it, and how you go about fixing it?
Yeah, the most common causes I see are usually trauma related. So oftentimes it's people with young kids that will reach up, especially with hoop earrings, and will yank on them and have them kind of rip through.
Yeah.
I think people that tend to wear heavier earrings, just over time, just because of gravity, unfortunately, gravity kind of pulls down and weighs down and will over time tend to elongate the earlobe and sometimes will tear through. And so those are probably the most common reasons that I'll see people come in, or at least the most common inciting factors. Fortunately, as we get older, we tend to lose volume and in all of our skin, and the skin doesn't have as much elasticity, and so those factors I think play a role too. Over time, they'll tend to tear through. The repair, there's lots of different ways that people repair these. There's all these complicated flaps and things like that. Truly, I found actually kind of simple is better, and so if you can reapproximate it, put it back together, and use some careful suturing techniques, I find that often tends to work the best. And one of the keys is when you go to eventually re-pierce the ear, try not to put the piercing directly where it was before, because in the best of cases, scar tissue has about 80% of the strength of normal tissue, and so it's always going to be weaker in that spot than an area that hasn't torn. So even putting it a millimeter or two off to either side or in the exact same area also helps.
Okay, and then how long would you wait before re-piercing the ear after the repair?
Usually wait a minimum of 6 weeks. You can certainly wait longer, but usually 6 weeks is enough time to at least get the initial collagen conversion and some strength into the wound.
And then you suggest placing it in an area maybe adjacent to where the previous hole was?
Yeah, to minimize the chance of it kind of tearing through again, especially if they're going to continue to wear heavier earrings. It's great if they would do studs and stuff to kind of minimize the chance, but so they're going to wear heavier earrings, then definitely I'd recommend re-piercing in a different area.